Sara Carter, you've been on the job for around 6 months officially.
Correct.
And I'm curious what you're most proud of so far and what goals you have for the future.
I'm overwhelmed and humbled by this position that President Trump has asked me to be in. Why? Because the most important resource we have is the American people. Everything we do in the office has to move forward the needle to saving American lives and also removing the stigma of addiction and working with people to ensure that they can get treatment faster and easier than they can get drugs off the streets. I think what makes me proudest right now is the fact that we are thinking outside the box. Our wastewater testing, where we can actually measure what drugs are in the system throughout the United States, really working closely with HHS and DEA and our Homeland Security Task Force teams that are working closely with our high-intensity drug trafficking area teams, all working towards one goal, to saving American lives. And that means getting rid of the cartels, Laura. That means following President Trump's directive to eliminate them, and that means ensuring that we are paying attention and serving the American people.
Well, Sara, I want to ask you, as director, your thoughts on a socialist platform. This is a campaign pledge they're making to stop fighting the war on drugs. What do you think of that campaign platform?
I think it's an absolute disaster. I mean, look, we've lost so many Americans to the point we can't even describe the toll of the loss of life, right? At the highest level, at the highest point, 1 year, 2022, over 112,000 Americans died of overdose deaths or poisonings. That was just 2022. If you look at the years that President Biden was in office, we lost more Americans during that time frame than we lost in World War II. Over 500,000 Americans, and this isn't just numbers on a board. These are real people who have suffered. They're 13-year-old kids that went on Snapchat, thought they bought an Adderall, and ended up at home dead in their bedroom with a fentanyl poisoning or a fake pill. This is how serious this is, because we have enemies that are intent on destroying us. And this is the reason why President Trump has empowered the administration to target these cartels, to eliminate them, and to also target nation states that would be willing to taint our supply chain with poisons that are killing our children. So absolutely not. The Democrats' end on the war on drugs would be the beginning of the end of the American people.
You just noted there is a concerted effort to address these drug cartels. Just this week, federal investigators seized 140 weapons that they believe were part of a major firearms trafficking operation via the Sinaloa cartel. So for anyone out there, Sara, who might doubt that these cartels are a big problem and that this administration is directly addressing them, what do you say?
Whether it is Sinaloa or CJNG or Beltran Leyva or La Familia, wherever they are at, you will no longer operate with immunity in the United States. We have stopped, for the first time, allowing the border to be an open, porous border where drugs were flowing in, where people were flowing in, where people were being trafficked, women and children. We are hitting them, Laura, at every single choke point. Whether that's in Puerto Rico through the mail, where we ran massive operations and seized tons of drugs and weapons and fentanyl, or whether that's in the most remote places of Alaska, where I've been twice in an effort to stop the drugs from flowing into our tribal communities so that the children, even in the most remote areas of America, are not being poisoned. More than 2 decades, I've spent my life on that border, and I have never seen in that entire career somebody who cared more about the American people and wanted to protect our nation more than President Trump. And that's the reason why I'm here.
Well, you mentioned this earlier, and I know you guys are using tactics and techniques that maybe haven't been employed in these specific ways before. You talked about wastewater testing. So give me a little bit more on that, because that is helping identify drug use and trafficking in real time.
Now, we are not violating anybody's Fourth Amendment. We are going to sanitation sites, and we are pulling the wastewater from there, and we're able to see what drugs are in the system. And let me give you one example of something that was a really big success for us. So it's known as rhinocerous tranquilizer, right, on the streets, because it's meant for very large animals. Well, we were able to see that in our wastewater testing, and we were able to issue an alert for the first time with the CDC to hospitals and first responders that this was on the street. Be prepared for it. So we're already making a difference because we're thinking outside the box. And especially in this day and age when technology is so readily available, it's unlike anything we've ever seen. I akin this to the Industrial Revolution. We have artificial intelligence. We have the top scientists working on these projects. We can save American lives.
I wonder if you can explain, especially when it comes to not only holding criminals accountable who are, trafficking illicit drugs, but simultaneously taking the stigma out of addiction and helping. There is a big group effort here with this administration to tackle both of those.
You can see the smile coming on my face as you were saying that, because it is exciting. I can pick up my phone. I can call Terry Cole. At the DEA, I can reach out to Stephen Miller. I can contact Catherine Burgum, Secretary Kennedy. We all speak to one another, and we're all speaking the same language. It's not a competition. It's about saving lives and working for the American people. And I'm so excited to be working with Catherine Burgum on the Great American Recovery Act. And when it comes to treatment and recovery, we have so many ideas. We have such a long way to go, but we're already implementing it because we're working together. We're bringing faith to the center, the core of our values, our national drug control strategy. So we are working on ensuring that the American people have choices, that we are going to provide them with what they need for effective treatment.
Well, at the end of your tenure as our drug czar, I'm curious what your hope would be for the war on drugs at that point.
I pray every night that at the end of my tenure, no more children are dying. It's very hard. You're a mom. I'm a mom. I can't even imagine the kind of impact it has when a person loses their child in such a abrupt way. We're already seeing the success of that. We have reduced the number of deaths since the highest point by over 40,000. That is over 40,000 people's lives who are saved, 40,000 people who are here with their families, sitting at the dinner table, laughing with their kids, going to the park, maybe in recovery, maybe struggling, but they're alive. I want to see those numbers go down to zero. I want to see people live. I want to see them be free. I want our kids to be happy, healthy, and clean, and to want to be drug-free. We're going to work on it as if that was the mission. If I'm not doing that, I shouldn't be here.